Now I will demonstrate the progression of the core exercises. So I would like you to activate your deep core stabilizers, which are the Kegel and the TA and the Multifidus, before you do these movements. So the progression we're going to do obviously is from very simple and basic to most difficult. The first step I want you to do is lie flat on your back with your knee bent. We call this crook-lying. So the first thing we're going to do is called bent knee fall out. So basically in here, you could put your feet kind of together. They don't have to touch. And I want you to engage your deep core stabilizers that we talk about. And I want you to let one leg drop. So you go to about 45 degrees and bring it back. Now that looks very simple, but you want to make sure when you drop the leg out, you do it slowly and while engaging your core. So what you do is your pelvis should not rotate at all, okay? If you want, you could put your hands kind of behind your back, underneath the belt line. So when you drop, if your pelvis started to roll, I'm going to exaggerate it, you'll feel that your bone actually compress your hand into the bed. Then you know you lost the stabilization. So you're going to put your hand there, engage your core, drop out gently, go to about 45 degrees from vertical line, and come on back. So again, the same idea, this is quality over quantity. You should be able to do this without moving your core. So obviously I would say you do your one leg first. If you could do it 10 repetitions, come back to the midline, take a break, do 10 times on this side, and do 10 times on the other side. If you do both of them together, they will kind of cancel out each other so you don't challenge your core as much. So the second progression is we call a heel slide. So the same idea, we're going to engage our deep core stabilizers. I want you to slide your heel out gently, slowly, and back. The whole time, make sure you engage your core, okay? So same idea, if you want to put your hand there to feel. So now as you elongate your leg, it creates more force based on the fulcrum on your back. So that challenges you to use your core more. So that's the second progression. The third progression we call supported hip lift. So in this starting position, I want you to engage your core, and I want you to just basically lift up this heel off the bed. When I lift up, I'm gonna go to the point my thigh, or the top of my knee, just pointing towards the ceiling, okay? And slowly back down. So when you do that, make sure your back stays flat. Like I don't want to see any arching in here. I don't want you to push it down too hard. Really just engage and lift up, okay? And then go down. So same idea, you're gonna do it 10 times on the right and then go to 10 times on the left. If you could, come back to do another set of 10 on each. So you're doing 20 repetitions in 2 sets, okay? So the fourth progression we will do is called a supported bicycle or straight leg raise. So in the same position here, I want you to engage your core, and we're gonna lift it up like we did the last one. We'll call the hip dip, and I want you to straighten it out like a bicycle. Okay, now my leg is kind of straight. If you drop it a little bit, it will make it more difficult for you to come back. So if I do it in a smoother way, I'm gonna start from the beginning position. I want you to engage your core stabilizer, pick it up a bit, straighten it out. Really watch out as you extend your leg, you engage your core, and then come back, and then dip down, like that. Okay, so I call that supported bicycle because the other leg is supporting your back. Okay, now we're going to go into more difficult progression. So here we're going to do unsupported stuff. So remember we did the supported hip dip. Now we're going to do it unsupported. Basically, it means you're gonna engage your deep core stabilizers, lift up both legs, make sure your back is stabilized, and I want you to just dip down and come on back up. Again, watch out that your spine doesn't rotate, okay? So it looks easier than it is. So you just go like that, okay? So that's unsupported hip dip. Then we're going to do unsupported bicycle. Again, in similar way we did with the supported bicycle, except we're gonna lift up our legs. So we're gonna go 2 legs off the bed. I want you to straighten it out. This is very difficult now. And then come back here. So try to do a bit more smoothly. Engage your core and come on back. I'm starting to lose it, as you can see. So when you go out to the end, if you go lower, it really is very difficult there, okay? So this is unsupported bicycle, okay? So the last level is both leg unsupported bicycle, which I'm not able to do it properly actually. So we will lift up our legs, and I want you to go both out. So there, at that point, I feel like my back is already losing it. But obviously, if you're better, you could go all the way down, right? And come on back up and this way. So what I meant I couldn't do it is that as my leg extend out, my stabilizer is not strong enough to hold me down, okay? So you don't want to be doing like out and your back is all arching up. That is totally not good for your back. You're actually straining your back doing it. So this is actually very, very difficult. For a healthy person to do these progressions that we talk about, it might take you like 8 months to get to do this unsupported both leg bicycle properly. So don't feel frustrated if you cannot get it very quickly, okay? So the most important part is you have to engage your core and stabilize it when you do these exercises. That's the whole point. And basically your core needs to be strong and stable for your arms, and legs to work on them. If you cannot stabilize this for you to do that, then you will actually strain your back. So we did a lot of core stabilization lying on our back and moving our legs. Now we are going to do some lying on your stomach and going the other way, which we call extension. So from a very simple way, if I lie on my stomach, we're going to go through progression. So I'm going to do, it's like a glue setting. So basically, I would normally put my head down like this. Obviously, you don't have a hole in at home, so just use your hand to prop it up. I'm going to turn my head just so you can see me. So basically, I would say if you engage your glutes, and it's very simple if you just squeeze your buttocks together and then relax, okay? So that's the first step to do. It really shouldn't be too difficult. Remember to engage your deep core stabilizer with the Kegel and the TA and the multiply before you do the butt squeeze, okay? So that is the first step. Then I want you to try, if you do the, we call them glutes, okay? So we do the glue setting, meaning you squeeze them. I want you to try, then you just lift up your leg, just very slightly. Now, it might be very difficult to see, but basically I'm just lifting my thigh away from the bed, just tiny bit. Okay, maybe like, 1 centimeter even. So you're gonna engage the core, the glutes, lift it off just a little bit. Keep your knees straight, relatively speaking, at this point, and bring it back down. So the same principle we talk about when you lift this, make sure your body does not rotate, okay? So the whole idea is to stabilize that and lift it off, okay? Now, obviously the next step is we could try is if we do both leg squeeze and both leg lift. Okay, so this is going to be quite difficult to do and bring it back down. Okay. Once you finish the exercises with the glutes and the leg, doing 1 leg lift and 2 leg lifts, we could start to introduce your arm motions into it. So lying on my stomach here, I want to show you how I introduce arm motion. So I'm going to lift my right arm and the left leg. So I'm going across my body, okay, like this. So lying on my stomach here, I'm going to lift my right arm and my left leg, okay? So I'm going to go here, and I'm going to lift up just a little bit and come on back down. Now, make sure your arm, don't try to lift it away from the table too high. Same as the leg, you don't want to lift it up really high. You don't want to hyperextend or arch your back backwards, okay? So you almost, again, you just lift your arm and leg away from the bed. Even 1 centimeter is enough. And the key, again, is the stabilization. So I'll do right arm and left leg once. And going back down. I might repeat 10 times doing that one. Then switch over to do obviously my left arm and my right leg. So in that case, you are able to strengthen both sides of your body. So the most difficult part would definitely to be a Superman or Superwoman where you lift up both arms and both legs at the same time. Like this. And bring it back down. So again, try not to lift your arms or legs away from the bed too much, but it does produce quite a bit of a resistance for you to stabilize against your core. So that was the first step where we did our core stabilization lying on our stomach, lifting arms and legs. The second progression, we'll go into the bird dog. The bird dogs basically is like this, which we call 4-point kneeling, okay? So We could start off doing just your one leg lift. Again, try to keep your back straight and don't rotate your back, okay? So if you imagine my back, make sure you're stable when I lift my leg. I don't want to see any rotation. I don't want to see any kind of dipping there, okay? So from here, we're going to engage core and lift it up and bring it back down. So you can start with just doing legs, and you could also do it with just arm. Okay, so I would do like 10 repetitions each arm and each leg. And then we could do the combination of opposite arm and leg. So you finish one side, you could do the other side as well. Okay, so in summary, we talked about these deep core stabilizers, where we did with our Kegel, our TA, and our Multifidus. And then we did more global stabilization exercises with lying on our back with the supported and unsupported hip dip and bicycles. And then we did some on our stomach where you lift your legs and your arms all together. So if you could combine these, they'll be really good for your core stabilization.